Let's see how this works here. Okay. I am going, again, my name is Tresa. I'm going to jump right in because I have not too much time, and it was a real struggle putting together this presentation because we've gone at this issue in our research in our firm at so many different angles, not totally head on, and I'll sort of end on that note why I think that is. But we've done a number of studies on healthcare costs, quality, payment reform. Chuck from MSNL we worked with for RWJ on a recent project that he mentioned on healthcare costs and just where our consumers, I'm going to draw a lot on that. We've done work for Aligning Forces, communication work for them with Chuck and as well as Patrick McCabe at GYMR, delivery system reform, comparative effectiveness. We're now doing a lot of work on exchanges. So probably about 80% of my work is healthcare, and about 100% of that relates to costs and quality in some way. So what I'm going to go through is one, just where the public is on value, because I think we always need to know where the public, we need to meet the public where they are at, or any audience that you're trying to communicate to them. You need to understand where they are. Then I'm going to talk about some global recommendations around talking to the public, consumers, and patients about value, costs, and quality, some overall points. And then some key takeaways. I went through some different studies we did on shared decision making, on payment reform, and I just sort of cherry picked some of the best sort of practical advice we could give around these topics. So first, where the public is, the public's not there yet, as we all know, but we're on their way. You know, I think listening to David, I think I saw what he is seeing, I've been seeing in the last year or so, the last couple years, as people pay more out of pocket, they really are, they're snapping awake, they're really becoming alert. They're changing behaviors. So the study we did for RWJ, there were a couple Medicare focus groups, as Chuck said, those were different. And then it was everybody had a deductible of $500 or more. That was the screening to get in. And these people, it was shocking. They're changing behaviors. You know, 1 or 2 in every group said, I'm not going to fast food anymore, or I'm exercising more, because they're paying more. It was really shocking to see this. They're foregoing unnecessary care. I had a guy who said, you know, my doctor ordered an x-ray for my foot. He thought it was broken. I thought it was gout. I said, I'm not paying the $400. I'll wait a week or 2, see what happens. Didn't need it. I'm going to call the nurse instead of going into the doctor. All of these sort of consumer behaviors that I just never saw 4 years ago, even 3 years ago, 5 years ago. People, the downside, people are foregoing necessary care. That's absolutely happening, especially among the uninsured. Broken bones, even for preventive care, all of it. But in terms of the attitudes around value, I think that is shifting. We had 1 or 2 people in every group ask about costs before they were going to get a procedure or test at a hospital. Again, this didn't happen 3 years ago. We never heard this. I know there's been a lot of research linking that consumers, the public links quality with costs, and we've seen that in our research as well. We're starting to see that shift a little bit, especially with people who are paying more out of pocket and more alert to these issues. In these focus groups, we gave people a hypothetical situation. This surgery costs this much here, costs this much here. What do you think the difference is? About half of people said something related to quality. You know, maybe they have better technology, maybe they specialize in that procedure. About half said we're unrelated to quality. Maybe the market maybe it's a socioeconomic, status of the market. Maybe it's their concierge. Maybe they're a teaching hospital, that costs more. Anyway, I'm seeing that kind of change. I'm seeing some openings for that, talking about costs. The final point on value is we're just seeing there's all of these factors coming together that they're really driving people to be engaged. You just have to be engaged in healthcare now. You have to take on more responsibility. It's a fragmented system. We have caregivers, bringing their file folders from doctor to doctor. You have less time with your doctor, so you leave and you go home and you spend 2 to 3 hours on the internet. By the way, this is really just women, but there's a lot of things going on, even with exchanges. Now this is a self-service environment. You have to go on, you have to make these decisions about your healthcare plan, what healthcare plan is right for you. So I think all of these factors provide an opening for talking about value and getting the public there. So just some global recommendations on talking to the public. First thing is talk about the impact on the patient. The patients, and I hate to say this in front of Marge, but the patients don't care about the healthcare system. Consumers don't care about the healthcare system. When we're out there talking about payment reform or talking about changes, the number one thing they want to know is, how does this affect me? And then the second thing is their doctor, and that's what they care about. When you're talking about quality, link it to how the quality between themselves and their doctor and how those specific things are going to change. So really think about the individual patient, emphasize solutions more than problems. We've seen this a lot. You know, the public is skeptical, they're worn down, they don't want to hear about problems, but especially in healthcare, you almost see a wall come up when you, for example, talk about getting the wrong tests. I mean, they just don't want to think about it. I think you need a psychologist to help figure that out, but there's just a wall up. They talk about getting the right test, not the wrong test. Talk about solutions back into problems. I'll give you an example of that in a second. I think what we're seeing as the top motivators for changing for engagement, again, is out-of-pocket costs and also getting the best care possible. That's language, I think Chuck may have come up with that language. Getting the best care possible, we've seen, it is, again, another big motivator and another thing to talk about. The Choosing Wisely campaign chose their name wisely. Did we have a hand in that, Daniel? Naming that?
No, not at all.
Okay. No, did we?
No, it was done by Lori Slaus, who's the VP of Communications.
Well, she was.
We had a little bit of a brainstorm.
Okay, it was very good. And in all of the work we've done in the last couple of years, we've used the phrase, the best phrase we found to talk about costs is that healthcare is so expensive, it's important we spend every dollar wisely. The goal is not to spend more money, it's to spend money in ways that best serve the patient. But that phrase, spend dollars wisely, is the one phrase that sort of everybody can get behind. It doesn't trigger a bunch of negative reactions. As we're thinking about different efforts, whether it's shared decision-making, delivery system reform, different efforts, when we link it in messaging to credible, prestigious healthcare systems like the Mayo Clinic or like a local respected healthcare system, that piques interest, and it also it lowers people's fears about the change. Like, oh, okay, if they're doing it, well, why can't I? So that has been successful in a number of different topics. Use examples. So value is such an abstract thing. For consumers, it's just really hard to get your hand around. You don't have experience, you don't have exposure, so examples are really important. I'll give an example of an example in a minute. Target women. So this is, you know, I was doing an interview in Dallas a couple weeks ago on hospital readmissions, and I had this guy, he was about 55 years old, really quite healthy. I think he had some chronic conditions, but quite healthy. He golfs every week. He was recently remarried, so he was divorced for a time, taking care of himself. And I said, does your wife have to bug you about getting in to see a doctor, trying to get at his wife's role? Newly married, he was on his own. He said, yeah, she does, and she lays out my medications every night for me. And I just thought, really? Does this happen? I mean, how did you survive on your own? And it just, again, just reminded me that it's really women who are making these decisions and who are really going to lead the change. It's women 35 to 64-year-olds who have a parent who's getting sick, who has a child who has asthma and been dealing with the healthcare system, who has a husband who won't get a colonoscopy. These are really, women in these age groups are really the ones who are going to lead efforts, I think. So I'm just going to, I'm going to touch on a couple different things we've studied around value. I think first on shared decision making, and I think there are people in this room who know a lot more than me, but when you're talking to patients about this, the top motivations that we've found is getting the best care possible. That's a reason to participate in shared decision making, because I know me best, I know my body best, improving the doctor-patient relationship, and then learning more about health and your treatments. We found that one piece of advice when you're talking about shared decision making, you're communicating that to the public. The examples we think to use are surgery and medications. You probably already know this. Surgery is seen as the most risky. These two things are what patients most want involvement in. Surgery, number one, then medications. because side effects, and there's still an instinct not to want to go on a medication if you don't need to. Diagnostic test screenings, they're more apt to just say the doctor can tell me when I need to take that. A message that really worked, we tested a number of different messages. A takeaway message that worked well among consumers was part of getting the best care possible is having a doctor who listens to you, answers your questions, includes you in making decisions about what treatments are best for you. So just a few takeaways around that. Price transparency. So we did in this recent RWJ study, we wanted to get consumers, the public's reaction to the wide range of prices, and we tested about 8 different examples. This is the one that did the best. A recent study looked at hospital charges to remove an appendix in California. The price ranged from $1,500 to $182,000. These were not outliers. Many were more than $100,000 and many were less than $2,000. While some patients were sicker, about a third of the price differences could not be explained. This again woke people up. This was persuasive to people, and they thought, okay, I'm going to start paying attention to this. It was motivating. We looked at a number of different examples. The reason this one did best was, number one, that huge variation, just the range itself. The second one was using dollar amounts. Some of the ones we tested, we said, oh, this was 12 times as expensive, or they're 7 times more likely to get this procedure. It was really the dollar amount that appealed to people. That they were not outliers, that the statement about that the cost could not be explained, very important, and that this was a routine procedure. People thought, well, it should be, first of all, cost less, and it shouldn't be so. The prices should be more routine. So that was a really good example on that. I think the last, just because does this mean I have 1 minute left, or I'm over? Okay, I'm going to go one last thing then. So we did a few years ago for the National Partnership for Women and Families, they asked us to do research on delivery system reform and how do we talk about care coordination, medical home, health IT, payment reform, and that was our introduction, and we said, back away slowly from payment reform and turn around and run, and don't talk about it at all. It was so hard, and then RWJ decided they wanted to figure out how to talk about payment reform, and it took us about 25 focus groups to get it right between both projects. So just a few do's and don'ts. I think this highlights some lessons we learned for other topics as well. Don't talk about how doctors are paid. That's where consumers start thinking, all doctors drive Porsches, and they get down that road, which is really distracting, takes them off issue. Instead, we found that when we said how insurance companies pay for care, so shifting that focus from how doctors are paid to how insurance companies pay for care. And it wasn't really villainizing insurance companies. It just seemed to neutralize the discussion. Don't talk about doctors giving too many tests because of incentives and that kind of thing. People don't want to throw the doctors under the bus. So talking about blame, again, a little bit better on the insurance company, but again, it was just more sort of neutralizing, saying right now insurance companies pay doctors based on how many patients they can squeeze in a day or how many different procedures. Rewards and incentives fails every single time, 100% of the time with the public. Doctors shouldn't be rewarded for something they already should be doing already. They should already be providing quality care. They shouldn't be rewarded for that. So we found instead, make sure the way insurance pays for healthcare is consistent with the way you want to receive it, sort of take at that high level. Getting the wrong tests, again, talk about getting the right tests instead. Getting unnecessary tests. Whenever we have that language unnecessary in it, 3 people in a focus group always say unnecessary to whom. So we found getting the same test twice helps. We also found for some reason tests you don't need. For some reason, I don't know if there's cognitive linguists here, for some reason that does better than just flat unnecessary tests. I think I'll just wrap up, and there's a study online from RWJ on this, but what we did walk away with a successful, effective way to talk about payment reform. It was shocking, and it's really starting about finding the best ways to provide quality care, backing into it. This means X, Y, and Z, how patients see quality. It also means coordination and communication with your doctors. Then we bring up finding better ways to pay for care in the way you want it, based on medical evidence, your doctor's recommendations. Goal is not to spend money wisely, or spend more money, but to spend money more wisely. I think that's it. I think the last thing I'll say is just, there's not, part of the problem here is the public doesn't have an understanding of rising healthcare costs. They just don't. If there was a baseline understanding of that, I think all of our jobs would be much easier. I don't see a coordinated effort around that. Consumers think about healthcare costs in terms of health insurance costs. That's changing with the high deductibles, but there's just a real lack of knowledge about rising healthcare costs. So I think that's last thing I'll say. Thanks.